a subject that everyone feels very strongly about, whether you're a smoker or you're a non-smoker. Nobody seems to be really straddling the fence on this issue. So we have a few guest speakers here today to discuss what's coming down the pike and discuss some issues that are current and that you can do something about yourselves. I also am offering information on smoking cessation for anybody who is interested after the meeting. So without further hesitation, we have Marilyn Edge, who is the director of the Western Bristol County and Foxborough Tobacco and Alcohol Prevention Coalition.
And you thought you had that.
Hi, my name is Marilyn Edge, as Pam said, and I have an office here in Fall River at Government Center. And I originally called Pam because I seem to have gotten, in the past year or so, numerous letters from people who have either not signed them or signed them with a first name, last initial, but put their return address as this building, complaining about having to deal with taxi cab drivers who smoke in their vehicles. So I called Pam and I said, you know, I know you have some people who are having issues with this, and I would like to meet with them where they are so that we can have a discussion about what they need to do and who they need to tell and what information I need on a complaint. So then Pam asked me about the smoking cessation and the smoke-free housing issue. So this is Alice Rebello and Nikki, whose name I can never remember, Nebraska, are going to talk to you about the smoke-free housing and what's coming down the line for any housing units, any housing buildings that get HUD funds, whether they be fully funded or partially funded, and what they're working on with smoke-free housing. And then when they're done, there's supposed to be someone else coming in. Her name is Angela, who's a smoking cessation certified person who's going to talk to you, but she can talk to the residents as well, about doing smoking cessation classes right here so that people don't have to go out for that. So Angie's supposed to be here in a few minutes. And then when they're all done, then I'm going to stay, and I will stay and talk to anybody about this smoke-free taxi issue that is having problems. And if you know anybody else who has similar complaints in the building, if you could let them know that after this part of the meeting is over, I'm going to stay and we can talk about that.
Thank you everyone for coming here tonight. Let me just give you a brief history of what our program is. We work for the YMCA South Coast, which has Fall River, New Bedford, and Wareham. So the federal government, the Centers for Disease Control, looked at the regions of Fall River, New Bedford, and Wareham has one of the highest in the state for smoking-related diseases, pulmonary diseases, heart diseases, and so forth. And so we were funded to work primarily with public housing, multi-unit housing, employers, behavioral health centers. So one of our main focus is actually to provide education and technical assistance to public housing apartment complexes in the 3 cities. So we're not the smoking police, we are not the enforcers, we're educators. And I'll let Nikki speak a little bit more about what it is that we do that provides education when it's needed. So we look at assisting property managers implementing smoke-free policies, because this is what eventually will be coming down the pike. Everyone will be able to breathe better, and we'll be part of the Breathe Better campaign, because that's what we hope to do. Our project name is actually South Coast Healthy Housing and Workplace Initiative, but we decided to make it a friendly approach and call ourselves the Breathe Better campaign, so that, you know, if you've noticed, before you light up, you look down, a campaign that the mayor in Fall River has recently adopted. So we're looking at implementing smoke-free policies in large apartment buildings to help protect the health of those who are exposed to secondhand smoke. So what happens when a property decides to go smoke-free? And I'll give you an example of the 3 public housing entities that we are partnering with. New Bedford Housing Authority has gone ahead and said to the tenants in January 2014, there will not be any smoking in the units anywhere.
This is New Bedford.
This is New Bedford.
Oh, no,
And-
Fall River?
Pardon?
Fall River?
Not quite. We're working with them now. They're not quite there yet. So, and in January 2015, there will not be any smoking anywhere on campus. But it's a long process to get people there, to get people ready. We are not saying that within the next 2 weeks or the next 2 months, we're going to go smoke-free and you need to stop smoking. No. We should take steps in helping people prepare for the implementation of the policy. So we're not targeting the smoker, we're just eliminating exposure to secondhand smoke. And I think, I'm sorry, I didn't catch your name?
Danielle.
Danielle,
Yeah.
you were mentioning how compromised your health is. And you have asthma, you have ailments that obviously are jeopardized by your exposure to secondhand smoke.
And that's all it is.
So, and this is what we hope to do. Not only do we hope to educate you, we're hoping to link you to tobacco treatment. And Nikki's going to speak of that as well. All of us are certified smoking cessation specialists, so we understand the addiction. We understand what it's like to be a long-term smoker. And it's a very difficult thing.
You don't want to quit.
Right, so, and we respect that. We
Really?
respect everyone's right. However, I must tell you that being a smoker is not a protected right under the Constitution of the United States. But being of a compromised health, it is protected. So if you'd say to me, well, I like to smoke and it's my right to smoke, it is your own right to smoke, but it's not protected under the Constitution. But Danielle's right to not be exposed to secondhand smoke is protected under the Constitution. So,
But I don't have any problem with you smoking. I
right,
just can't
so
be around
it's
people
for
that
health
smoke.
purposes that we're doing this. And this is why we call ourselves the Breathe Better campaign, because we're hoping to protect the health of those who are exposed to that secondhand smoke, even third-hand smoke. So, for instance, and I'll give you an example of third-hand smoke. Danielle has a small child and she's walking down the hallway with that small child. You just got done smoking a cigarette and you want to hold that baby. We all have that tendency to pick up a baby and hold the baby. That baby is being exposed to that smoke that's on your clothing. That's third-hand smoke. So it's actually an irritant. It can irritate the nasal passages, the mucus lining. Breathing patterns can change while that child's being held by you. That's third-hand smoke. So in essence, we're just limiting, helping people to protect themselves from the exposure. Not that we're trying to alienate you. That's not what our goal is. Our goal is to say to you, have you contemplated quitting smoking? There's help out there, most of it free. Right now, the quit line, is it quit line or quit works? Quit line.
Quit work.
Quit.
Quit work.
Quit works.
Isn't it quit work?
No, well, there's one in particular that has two free week worth of nicotine patches that can help you try to quit smoking or limit the amount of cigarettes that you smoke. So for instance, if you normally smoked a pack of cigarettes a day, decreasing that to a half a pack is a milestone. If we can be of help to you, we can certainly provide all the assistance that you need, just like if we can provide the technical assistance to your project manager, to the owner of the property, implementing that smoke-free policy, that's our job to do so. We'll provide you all of the supports, all of the technical assistance. We have simple policies that we can help put into place so that you don't feel like you have to get out there. Again, we're not trying to alienate anyone. We're just trying to provide as much help. But without further ado, let me just introduce you to Nika Dubrowski. She's my wellness advisor. I'm the project manager. And her role is, in addition to providing additional help to you, she also provides technical assistance with implementing policies around the healthy eating and active living. So she'll get all of you in tip-top shape.
Thank you again for coming and for having us here today. So like Alice said, I'm the wellness advisor. A piece of our project is around healthy eating, active living. So when people are trying to quit smoking, we try and teach them healthier eating habits and how to get moving. So that's it's in addition to quitting smoking, or even if you're a non-smoker and you just want to get healthy anyway, that's something else that we do. So my role would be to work with Pam directly as the RUS coordinator and come up with plans to help implement for the residents here in all the units. Now, like Alice said, we're not trying to alienate anybody or target anybody in particular. We're just here to help. We're here to provide education. Around smoking, I'm also a certified tobacco treatment specialist, so Angie's going to be here hopefully shortly. I think she said around 5:30 she'd be here, so she's going to talk to you. So between her and I, we can help provide any cessation that people need, whether it be one-on-one or group counseling, whatever it is that people need. We'll provide the education, we'll provide them the resources they need to get linked to quitting smoking, not only quitting smoking, but healthy eating, whether it be with a dietitian, a nutritionist.
Where have you been for the past year and a half? I have been trying to drag and pull the people who live here into health and wellness.
We're here now.
Yeah, program just initiated.
Haven't I, everybody?
Yeah.
I really have. I've been, when I first got here, they had donuts in pastry every Thursday for coffee hour. And I really screwed that up for everybody, didn't I?
Making us eat scrambled eggs and nervous.
I started making scrambled eggs and having the whole grain English muffins and fresh fruit. And they haven't served, they used to have, when they had things like this, they used to have cookies and cake and cupcakes. And they don't have that anymore. I get hummus and the whole grain tortillas, and I've tried to start a walking club a few times, so if you can hop on board here and give me any help or assistance.
We can definitely meet one-on-one when Linda's on board too in Fall River. Linda will probably be more of the go-to person when it comes to the policies around smoking, but I can certainly help you with the HEAL. I have a background as a personal trainer as well, so I'm a certified personal trainer. That's a side note, Dave. So healthy eating, active living is something that I do on the side as well.
Okay, fantastic.
So not only with that, but we have people at the YMCA that are certified fitness instructors, aquatics, yoga. So we have people, we have a whole group of, because we work for the Y is definitely interested in helping out. So there's all these instructors that we could potentially bring in here.
That would be great, because I think that every time that I've reached out to somebody, I've had the same answer, like even with the American Diabetes Association, no, your people have to come to our location. And I'm like, what don't you get about the fact that this is low-income housing? Most people can't afford a car. A lot of people are here because they have a physical disability. They don't have a car. They can't walk there. Your schedule might not be on the bus schedule. It might be snowing or raining out that day.
So it's difficult for people to get out and get
Yes, it
services
is.
that they need.
Yes,
So
it is.
we're here to bring them to you as much as we can with the people, the resources that we have. And we have quite a few, and we're building those resources every day. I'm working with an employer in the Fall River, New Bedford area who, same thing, they wanted healthy, they wanted to do the active living piece for their employers, but their employers are so busy that they don't have time to go off-site. So they wanted to bring a fitness class to their employees, so we set that up for them. So they're going to be offering a fitness class once a week, 45 minutes for their employers at a small cost, because you have to pay sometimes you do have to pay the instructor or the person that's coming in to do the education piece, but a lot of our resources are free also. So there's, either way we can find something. So that's our role, is to provide you the resources to hand out to the residents.
So everybody here has come to one thing or another. So if we could just pull it together.
Amen.
Okay, I'll raise my hand just to support you.
Thank you, Ron.
You're welcome.
Ron, you've gone to walking club. You've participated.
Yeah,
in
when I
walking
can walk,
club.
yeah.
You got a comment in my room.
And there's ways to get people involved. There's many ways. There's incentives. People love incentives. Right?
Yeah.
Food.
Yeah, I've been teaching Pam about food. Food.
Ron will come to
Look
anything
at how many
where
people
food
you
is
got
offered.
because there's food here.
Nutrition cooking classes, healthy cooking classes.
I wanted
So, I
to
mean,
start that.
You have
You know what, I went to Stop and Shop and tried to explain to them what I wanted to do. I was going to do a healthy nutrition class just once a month. And then I was going to take one of their sale items so that I could advertise their sale item. At the same time, I could show people how they could cook that in a healthy manner. And they said, oh, no, everybody is knocking on our door for a donation. They said, you'll have to get in line with the rest of Fall River. And we only donate to people once a year. And I'm thinking, they're just not getting it. I just don't want something for free. I'm going to be advertising I'm going to be showing people your sale flyer at the same time and showing them. But
And we're getting involved with the farmers markets that are around, and they're starting to now, and Dave can speak a little bit to this as well as Alice, I think, about they're starting to take EBT cards.
They are, they were, as the last year they did.
Yeah, and they have farmers markets, South Coast Hospital Groups offers farmer markets at Charlton, St.
Charlton,
Luke's,
St. Luke's,
Toby.
and Toby.
Certain days a week, so we can get you those, which, there you get your fresh fruits and vegetables at a decent price.
Yeah, St. Anne's has one too.
A lot of people don't know this, but many of the nursing homes in the areas do marketing outreach. And part of the marketing outreach, and I speak from experience, is the marketing director will come out with a chef and they'll do a healthy cooking demonstration. So if you get on the phone and you call the nursing homes in the area and invite the chef over for a healthy cooking demo, I bet you they'll be more than happy because everyone's heard of the patients in their door. And the only way
because
is
we
to
have
do that.
had a few patients go into rest homes and nursing homes in the past year.
So guess what? You get that phone and you call that nursing home and you ask to speak to the marketing director.
Wow.
And you say to the marketing director, many of my patients have gone to a nursing home. You can feel it. It's okay. But many of my residents have been patients in your nursing home. And I would like to invite you here to do a little cooking demo on how to eat healthy. Cooking for two. A lot of them do cooking for two. They bring the ingredients. You don't even have to provide those. They bring the ingredients. And I used to do that quite often in the New Bedford area, the Dartmouth area. So every week I would go to a different housing complex. I did a lot of them, particularly with Peabody Properties. I actually did one at Borden East.
Yeah.
So, yeah, that's a little secret not too many people know.
Wow.
So, out there, particularly in the nursing home field and assisted living field, they love to do coffee hours. They love to do ice cream
Bristol
socials.
Elder Services.
Really?
Yeah.
Yeah, you'd be surprised.
You just
Your
need to
nursing
ask.
homes, your assisted livings, they love doing that because it's cheap advertising for them, really. It's worth investing $30 a week, whereas you pay $3,000 to put an ad in a newspaper. Yeah.
Wow.
They're always looking for a way to market themselves more in the area.
We
So
should do for
expand your search to the Somerset,
Bedford,
Swansea.
Somerset,
Yeah,
Swansea.
So this is the Angie Brass, and she is employed by Partners for Healthy Community.
Yes.
Southeast Fall River. And she's a smoking cessation treatment specialist. Yes?
Yes, that is right.
Angie. Go ahead.
It's nice to meet you guys. Sorry I'm late. Just wanted to come in and talk about services that we can offer here. My understanding is that the building's going to go tobacco-free, or is tobacco-free?
It's not tobacco free.
Okay.
Planning.
We're hoping.
Okay,
that it
great.
goes- well, not all of us, but probably the majority of us
Fantastic.
are hoping that it goes tobacco free. But my understanding is that that is coming down the pike eventually everywhere.
Will they get HUD funding? They'll get some HUD funding.
Okay, all right, so that's good to know. Okay, Well, one of the things I think I want to express is that I'm here for educational purposes. I'm here to help the residents quit if they choose to. We offer a smoking cessation groups, and that's no cost to you. And we offer a 6, 8, or 12-week program. And the residents can decide on a time that works for them. I can come during your lunch hour, I can come in the evening, whatever works for your schedule. And what we talk about is a lot around the behaviors of smoking, and then also how to address and help you to quit by planning a day to quit, as well as using tools to help prevent triggers for relapse. Are any of you smokers in the room? Yes, okay. So it's a judgment-free zone, and we talk about how to quit. So we talk a lot about nicotine replacement therapy. Have you guys heard of the patch? Or
I got both.
great, okay. And Chantix, have you heard of Chantix? Okay. So I'm a health educator, I'm not a nurse, but I can help connect you to your primary care doctor so that you can go there and talk about your choices as far as your medication or nicotine replacement therapy. Because you have a better chance of quitting if you use those methods. So that's just something to keep in mind. We can definitely do a program here if you're interested. I think the best thing to do is to really just offer maybe a sign-in sheet, or if you have, I don't know if you have a community flyer that goes out about your activities that you do on site, and we can try to promote it that way. A lot of it's word of mouth, but I'm happy to come and even just do a basic info session and see what kind of buy-in we get, and then go from there. But I can offer the group, and then the other portion of it then would be to connect you with your primary care doctor in order to get some more help as far as the nicotine replacement therapy. So, do you guys have any questions?
I was a smoker too. So, and I quit 24 or 25 years ago, but it wasn't easy.
So you're a wellness champion, I like that. Okay, great.
And just so that you know, I too am a former smoker. It's been 20 years for me. Nikki is a former smoker. So we really understand on a personal level what the addiction is. We do. And has all of us certified treatment specialists. We understand it even further. We understand the behaviors, the triggers, a lot better than anybody else would, just because we've experienced the addiction, and we can appreciate the struggles that people go through quitting smoking. So, you know, for you perhaps, and you do enjoy smoking, and as I said, I respect that, so maybe you want to think about reducing tobacco consumption just to save a little bit money. Maybe you want to go on vacation somewhere.
Plus the
That's true.
$17 a week, I'm not worried about saving.
So, you know, everybody has a little purpose. So you haven't found yours yet, but someday you will. We just want you to know that whenever that day comes, you have resources.
I'm well aware of the addiction. I've had other addictions. This is my last pleasure. Leave me alone. I don't go in her face and smoke, and I'm not in your face smoking. Why are you bothering me?
Well, eventually, any building that gets any HUD funding is going to go smoke-free.
Even
And-
state
Well,
funding.
eventually,
Even
I'll be
state
living
funding.
in a tent.
So what, and we've done, Dave and I did this meeting at another high-rise building not too long ago, and there was a woman who had the same opinions that you did. And what I said to her is, no one's telling you that you have to quit smoking, but what
You just
they're
can't live
telling
here.
you is if you choose to continue to smoke, and then you're just not going to be able to live here.
I think in the privacy of your own apartment, since it's a multi-unit high-rise, what happens is unfortunately the carcinogens go through the wall, so it goes to the neighbor that is potentially a non-smoker, and they are then being affected. This reminds me of my grandmother's living situation, and she died of cancer. She lived in Providence, and she lived in a multi-unit housing. It was government-owned, and I know this is private and a little bit of public funding. So, you know, that being said, I remember going in and I could smell the smoke in her apartment. So she was a non-smoker, but the smoker downstairs, the smoke went right through, so I could smell it in her apartment. So I think where we're at now in the U.S. is that we're trying to find a happy ground, and it is a slippery slope. Again, we're not making anybody, telling them, you know, you're bad, you're a smoker. We're trying to create a better living situation for everyone, but also advocating for the non-smokers. And there is, unfortunately, secondhand smoke. So you can smoke outside, depending on what the laws are at Ships Cove. You can go ahead and smoke. It's just a matter of the fact that you're in a multi-unit dwelling. So, I mean, I think that there's something to be said for your neighbor. You know, you want to treat people, you know, the way you would want to be treated. Go
To
ahead.
give you an idea, I live around, I'm not a smoker, but I live around smokers,
Yeah.
and it's so bad that I cover my vents
Okay.
just to try, because when I'm in the shower, all I can smell is the nicotine and the smoke coming on top of me. It's like, how can you get clean if you got all that smoke on top of you?
Yeah.
And I have to run a runner under my door because my neighbors smoke, and I love my neighbors, but, you know, most of them are smokers, and so not
Yeah.
to get that air in, I have to shove something under the door.
And how does that work for you? How does that, is that
Every
a
time-
good enough barrier for you, or
It
no?
isn't.
It
because-
is not.
I'll tell you, my office back here was a storage room. I have no window, no air conditioning, and no air vents. There is
No
nothing,
airflow.
nothing back there. And at certain times of the day, I am overwhelmed by the smell of cigarette smoke, and I get positively nauseous in there. And I'm a former smoker, and it just makes me sick to my stomach. And there's nothing, I mean, where is it coming from, I have to ask myself. I don't understand it. But the rules here at Ships Cove are that you have to be 20 feet away from any means of egress in the building, meaning any door, and 20 feet away from any window. So recently, the only place that there really is to smoke is under an overhang on one
Right
end
over
of the
here.
building.
So you have designated smoking areas then?
That is the new designated smoking area,
Okay.
but they're not enforcing it yet. But they have put up the no smoking signs in the
Great.
front of the building.
Great.
But they're not enforcing it yet, but they will be.
So they've eliminated it in the units,
No,
not yet.
no,
but just around the doors?
and around the
entryways?
If you don't mind
because it's a public
interjecting.
area.
I believe, just because, you know, I know people, I don't think it's gonna stop people from smoking. I think people are gonna smoke because they're paying their rent, and if they pay their rent, there's a lot of attitude in here that I'm gonna do what I'm gonna do. And that's what some of these people, you know, that's what some of, and unfortunately, that mentality makes somebody like me sick. I never smoke and I go through hell at the doctors 3 times a week sometimes because of
I
it.
can tell you that with the Bedford Housing Authority, the policy is very strict, very tight, in that when tenants came in this year to renew their lease, they had to sign an addendum with the understanding that in January 2014, there will not be any smoking in the unit, and they are subject to eviction. So you will see a lot of self-policing. You're going to see a lot of that. People will be unfortunately ratting on, you know, the neighbor next door. And so it may take a couple of examples of eviction for people to really understand that this is a serious matter, and we don't want to get to that. This is why we're here to provide as much help as possible, as early as possible, so that you're prepared. And Angie and Nikki are available to provide that help to you, because we don't want to see anybody evicted over an addiction. And that's not what the goal is. It's not what our mission is, and we understand that.
And we can even help with the reduction of the smoking. We can drop you down to a half a pack a day. So if you're ready, I guess the point is we're here. So they're going to enforce this policy, and we're here for services, you know, and we're here to help you at no cost to you.
Where
So,
do they sell good camping equipment? 'Cause
oh, oh, we don't want you to be
Walmart,
camping.
You know, and that's to be expected, right? It's gonna happen, we're gonna get pushback, it's nothing personal, it's just, that's the person's choice, and that's fine. You know, so from here we move forward, right? How can we help the residents that want the help? And that's what Angie and I are here for.
And I think that the other thing is too, like, I think the smokers feel really put upon and picked on, but I think that what they fail to recognize is how difficult it is to approach that subject with a smoker when you're the non-smoker also. There's the other side of that. I know my father is a heavy smoker, and and it really, really bothers me. It makes me sick. And I'm his primary care provider. And it just takes an enormous amount of courage on my part to try and approach that subject with him, or I mean, even if I open a window in the car while I'm driving him to a doctor's appointment, you know, he gets upset with me. And how do I tell my father, you're making me sick?
Come on in.
It's difficult,
It is a lot of challenges.
yeah. So I understand that they feel put upon, but it's difficult from the other side too, to tell them that they're making you
And
sick.
one of the things too that we can do is use a positive approach. So, and this is why we really emphasize the Breathe Better campaign, and my staff does as well, is using that positive approach. And you saying, Dad, I love you way too much to see you go through this. Can you just, for today, while you're in the car with me, just because I care about you, but using that positive reinforcement. So for instance, if you want to announce that we're going to be here doing education, rather than use a non-smoking, this to a smoker is very pushback. It's confrontational. So adopting the Breathe Better campaign, Cove cares about the health of all our residents. We will become part of the Better Breathe community. And we have posters that we can give to you. We will be ordering more posters with our program name and using that as a positive influence. And I'll give you an example. South Coast Hospital Group actually adopted that philosophy with the Breathe Better campaign. They started out about a year ago, I believe, maybe a little over a year ago, and they established a smoking hut right outside the emergency room, likewise with Fall River and Toby and Wareham, to get staff ready for the Smokefree campus implementation. And so now they're completely smoke-free, and people have become more aware because they look at the poster and it's just, you know, South Coast hospitals care about the health of our employees, and we have become part of the Breathe Better campaign. So using a positive approach, because you don't want to alienate the smokers, but you want to make them part of that healthier community. You want them to be more accountable for not only themselves, but for the neighbor next door. So you're more likely to get a response from a smoker if the smoker said, you know, they really are caring about our health, rather than to see that no smoking sign. It's very negative. If this works, has worked for municipal buildings, has worked for municipal vehicles, but we're talking about people's lives now, we're talking about people's homes. So you really don't want to be negative, you really want to be as supportive as you can. So using a friendlier approach, I think, may be more successful. But that's a choice that management can make on their own. But we will certainly provide you the Breathe Better posters.
That's great.
Does anybody have any questions?
Yeah, we'll wrap up because, you know, we understand that some of you may want to speak more.
Okay.
And I wanted to thank everybody for being here and being patient with us and listening to us. And I think
Our pleasure.